not.
Is that
It's
is
data.
that too far? Can you
She
get
go.
that?
I can get it.
You can get it. Okay, so if you stand there, we'll be good.
Okay, cool.
Okay.
How about you? You good? Can you get
You
her?
gotta
And
take your bee with you, though.
I
I
know.
can't be swatting at a bee during this thing.
if she can, mostly for she can get in the shot.
That's right.
Yeah.
She's a fake interpreter, like these ones
Right.
that they keep bringing out. She's just moving her hands.
Don't worry about everybody else. You just want to make sure you have here and the interpreter. Don't worry about the rest of it.
Can they get together?
Hmm.
I mean, honestly, it's pretty wide. If she stepped in like half of that spot, it just looks crazy on TV.
I got you.
Well, I mean,
I mean,
well,
it's fine. What if you got me? I'll do it.
yeah.
But anybody from that side to that white pole,
But here's
is
the
my
thing.
shot.
But here's the thing. You said what?
Everybody from that pole
Uh-huh.
and that pole, they're in my shot. I'm wide enough to get it. So anything within there, I can get the whole group.
Okay. Well, I don't know if you want the whole group or if you're trying to pull it in for sound bites or whatever.
Well, no. I need to establish. Because
Okay.
last time we've been doing these pool shots, we had no establishing shots in the place. So I need to establish for like 40 seconds. Then I'm in. That's all.
Yeah. So everybody who will need to be here will be here spaced appropriately.
Okay.
Yeah.
As long as they're within those two poles, I can get everybody.
Okay.
She usually acknowledges people before she dives in. Governor Hogan dives in immediately. Once he's opened his mouth, it's a bite.
Yeah.
So I got you.
So how are you holding up? You look really good.
I
I'm not gonna lie, but
was
you may
like,
be working to death and not sleeping, but you look
yeah.
good.
Busy.
If you're gonna
Busy.
feel tired and exhausted and stressed and everything, you might as well look good, right?
Well, I appreciate it. Okay. Good, how are you? Dr. Wright?
So you take it right, Brad, right here, right here. Okay.
So, when you're signing for the press conference, can you stand where Jerome is standing now?
I know.
Stand
in a different
wherever.
state.
I know, I
Stand
know.
as long as he can see me.
Okay.
Oh yeah, we see it. From.
Yeah, so let's do that because then we don't have to be quite as wide. We'll still be able to see you without
Kelly's
problem.
next here.
Okay.
She's sitting in her car.
The shot and make Angela say.
Roll in here real quick. I'm gonna make sure.
Get on the grass if you want to be comfortable, so a little soft before you put it in. Perfect.
Maybe
Yes, she is. Ma'am, I'll have you just stand straight down here. Yes, so wait. So, okay, Dr. Wright, all the way over here, ma'am, in front of the door. Right. Actually, let me have you guys just over here on the side. Just working them down. Yes. Okay, ma'am, you right there. Okay. Okay. Good afternoon, everyone. I'd like to thank you all for joining us. My name is Gina Ford. I'm the Communications Director for County Executive Angela Alsobrooks. So as you know, we are ramping up to a pretty critical time of this pandemic. So today we'll have County Executive Angela Alsobrooks to bring updates, followed by our health officer, Dr. Ernest Carter, and then our interim CEO, President and CEO, and Senior Vice President, Chief Medical Officer for the University of Maryland Capital Region Health. That's Dr. Joseph Wright, followed by the Deputy Chief Administrative Officer for Public Safety and Homeland Security, Mr. Mark McGaugh, and then following him will be Department of Corrections Director Mary Lou McDonough.
Thank you. Good afternoon, everyone. I want to thank you all for joining us this afternoon as we give some critical updates regarding our efforts to stop the spread of coronavirus in Prince George's County. I'd like to begin this afternoon by saying thank you so much first to Dr. Ernest Carter, who is our Chief Health Officer. I want to offer my thanks not only to him, but to our entire health department team. They have been heroic in their efforts to help navigate us through this pandemic, and we are so very grateful to each of them for helping us to keep our residents safe. I'd like to also thank Dr. Joseph Wright, who is joining us today. He's our also the interim president and CEO of the University of Maryland Capital Region Medical Center. I want to thank him for being such an amazing partner. To also thank Dr. Mohan Santha, who is not able to be here today, but together we have been communicating seamlessly to make sure we are making good decisions as we approach what we believe will be a surge in the next couple of weeks. I would also like to thank our public safety agencies, be it the Prince George's County Police Department, the Fire Department, Corrections, the Sheriff's Office. They have all been working as one united public health, public safety team, and they have also done a heroic job of keeping us safe during this pandemic and working to putting their lives on the line. And so to each of them, I want to also offer a very, very heartfelt thank you for the work that they have done. And to those who are on our front lines today and have been every day, the medical staff working in our hospitals, those who have shown up at our urgent care facilities and our FedEx site, for risking your health and safety to care for all of our families, our neighbors, our friends. I want to also say to each of those individuals how very grateful we are for what they have done and continue to do to keep us healthy and safe and to help us make it through this pandemic. And for the new heroes that we have all recognized now, those who are stocking the shelves at our grocery stores, preparing foods at our restaurants for carry out and helping to keep us fed during this pandemic, we also want to say to all of them, thank you so very much. And to our citizens and to our residents who have done an absolutely beautiful job of heeding the call that we have made each and every week for them to stay home, to social distance, and now to cover up before you come out for essential trips, we want to say to all of them, thank you. Now, I can tell you that we have 1,464 positive cases of coronavirus as of today. Included in those are 33 deaths. And so we want to continue to offer our prayers to all of those who are suffering, those who have become sick, and to certainly offer our heartfelt condolences to every family member who has lost someone during this crisis. And what I want to say today is so important, and it is that as you hear the numbers, and we give the numbers every day, we are ever mindful that we are not talking about numbers, we're talking about lives. We're talking about humans. We're talking about people who are near and dear to us, people we love who have become sick with the coronavirus. And so we have never once lost sight of the fact that we are talking about people when we talk about those who are sick, the 33 who are died. These are people like Terrence Burke, a counselor and beloved coach from Northwestern High School. From all accounts, we could hear people talk about him. He was a mentor, a father. He was a lifeline to so many young people in our community. and we want to offer our condolences to his family. We're talking about people like Sean Bowens, who was a beloved husband, a father, a pharmacist. He's a person who loved all things Howard University. His family, we came to know because their daughters attended school with my daughter. And so we want to offer our condolences to Sean Bowens' family, Nicole, and the rest of the family. We're talking about people like Leilani Jordan, a young woman who was a grocery store worker right here in Largo, Maryland. She was a woman who, in spite of her own physical challenges, disabilities that she suffered, decided that even during this pandemic, she wanted to continue greeting individuals at that grocery store. She wanted to help the elders who needed help navigating the store and finding their way through it, and she gave her life to the coronavirus. And so this fight for us is a personal fight. It has absolutely become personal to us because we're not talking about just numbers or statistics. Again, we're talking about our loved ones, our neighbors, our family members, our friends. And so this fight has become so personal to us. And in the last few days, we've heard more and more the conversation regarding the demographic information about who's being affected by the coronavirus. And it's, as I told you from day one, the coronavirus is a virus that is indiscriminate. It affects every corner of our county. It is black, it is white, it is Latino, it is rich, it is poor. But we have come to know most recently that the coronavirus has had a disproportionate impact on those who are African American, black, brown, those who are poor, disadvantaged, and impoverished. And that is, people have been saying, well, what is it that you think about that? And what I can tell you is that, unfortunately, we were not surprised to hear, because it is not just a data point that black and brown and disimpoverished and poor people suffer disproportionately with health crises. It is a reality that, unfortunately, we suffer right here every day in Prince George's County. We have become too familiar with it. And so when we heard that the aggravating factors for coronavirus included those who had diabetes and high blood pressure and lung disease and kidney disease, I can tell you that our first reaction was, oh my God, that's us. We knew already that this would be an epidemic that would hit our community especially hard. And so we have fought hard against it, but we knew that it would come to us. The information we have so far, and what I can tell you, is that when the coronavirus is done, we hope that we will never do business quite the same again in Prince George's County. That it is a fight that we know now affects so many of us. Of our total cases, for example, between those between the ages of 50 and 59 years of age lead the county in the number of positive cases, followed by individuals between the ages of 30 and 39, and third would be those between the ages of 40 and 49. We've also received some preliminary data regarding hospitalized individuals and those who have died. And what we know so far, although our information is not complete, we know that so far, out of the 33 deaths of the individuals we have information for, and some have been hospitalized outside of the county, and it makes it more difficult for us to get information for those who have passed in hospitals outside the county. But 13 so far have been black, and 5 have been white. And of the more than 1,400 cases, we have 325 who are hospitalized. Of the hospitalized individuals, we know that 78% of them are black, 9% are Latino, 6% are white, and 7 are listed as other, which includes a small number of individuals who are Asian and American Indian. We last night were really disheartened to learn that we lost a 90-year-old man to this coronavirus. He was living in a nursing home, and I can tell you that, unfortunately, this virus has not eluded those who are most vulnerable to us. And so we know that of our 20 nursing homes, 12 have at least one person with one or more positive cases. And so we are working, Dr. Carter will discuss our efforts to collaborate with those facilities to ensure that their residents are safe. This afternoon, I've had the opportunity to provide you with some preliminary data. Again, I told you that we were not surprised to learn that we would be hardest hit, even here in Prince George's County, because of the large concentration of black, brown, and impoverished individuals in our community. And that is the reason that we took health care so seriously. We know that there are many in our community who do not have insurance. And so when the initial information came out and we were talking about how to get tested, The answer we got about where to get tested was just simply go to your doctor. Well, we know there are a good number of people who do not have primary care physicians, and that's the reason we fought and pushed so hard to erect that center over at FedEx Field to make sure that those who did not have health benefits would be able to be tested and screened. We know as well that even in a county like Prince George's County, which is known to be the wealthiest majority African American county in the country, even here we have struggled to attract restaurants and grocers. And so again, we hope that when the coronavirus leaves, and we know that it will leave, when it leaves, we hope that we never do business as usual ever again. When together we rebuild, and we're going to have to rebuild. We're going to have to get ourselves healthy again. We're going to rebuild together the businesses who have lost revenue, the employees who have lost jobs. But when we rebuild and we continue to support, we're going to give a lot of support to our business community in order for them to recover. But what we ask is that after we have finished supporting the business community, we then hope that they will continue to support us, that they will bring their healthy foods to our community, that they will make sure that we're able to serve to our residents healthy foods. The grocers will come. We hope the restaurants will come here. And so now you ask, what are we doing today about this pandemic? And what I can tell you is that we have a plan for the upcoming surge, and we're executing it. That plan falls in 3 different areas: hospital readiness, additional supplies, and frontline support. In a moment, you're going to hear from Dr. Wright, who will tell you what we are doing to prepare the hospitals for the surge, ensuring that we have adequate staffing levels and resources that we need. But I can also tell you that I have reached directly to the governor, and I have requested of the governor, and I want to thank him for his accessibility and accessibility of his administration. But we have requested additional beds and equipment, asking that Prince George's County be prioritized, put at the top of the list, because we are now caring for the largest concentration of individuals who are suffering with COVID in the state. And so because of that, we're asking for additional resources to help us not only flatten the curve in Prince George's, but by extension, allow us to flatten the curve in Maryland. Our Chief Health Officer, Dr. Carter, will speak in a moment about our preparation. But again, I want to thank the governor for his support. We had the Corps of Engineers here earlier this week to look at our sports and learning facility as a site for a large alternative care facility. We have also requested sprung tents, which are smaller temporary sites to help us care for individuals. With those tents, we're going to place in the southern part of the county, the center of the county, and the northern part of the county. We also have triage tents at MedStar Southern Maryland, Doctors Hospital, and the University of Maryland Prince George's Hospital Center. And of course, with the assistance from the Redskins, we opened our FedEx site last week to allow us to screen and test individuals. You should know that we have so far tested more than 350 people at that site. And of the people who have tested there, we have found that at least a third of them have been positive for the coronavirus. As I mentioned, frontline support. I mean also our first responders. You're going to hear today from DCO McGaw regarding our efforts. And what we know is that we had to cross-train many of our frontline responders so that at any given time we have fire, EMS, and police officers and 911 dispatchers who may be out and may test positive. And if that becomes the case, we have cross-trained to make sure that we don't miss a beat in terms of our operations. What we know now is that going forward, if we have, for example, a shortage of EMS workers, we're training to make sure we can have police officers and sheriffs jump in those ambulances and drive. And so we are really putting together a robust effort. And I want to thank our public safety leaders, including Chief Stawinski, who is here today, for what they're doing to make sure we're prepared. Also, in our efforts to prevent the spread of this coronavirus, we've opened a quarantine facility in the county for first responders. That facility is in a hotel. We are not able to share which hotel for the safety and confidentiality of those who are quarantining there. But you should know also that our first responders are on the front lines, interacting with the public, and if exposed, many of them don't want to go home and take this to their families, and so we have prepared a facility for them to go to. Finally, just 2 more items, donations. As we draw closer to more difficult times, we want to thank everyone in the public who reached out to us to offer. They've reached directly to me, to members of the administration, and also the Office of Emergency Management to offer donations. Those donations to food, paper products, supplies, personal protective equipment, and other supplies. And so we have arranged a page, a donation page, which captures information of those who would like to donate those items to us. They can go to mypgc.us/donate COVID-19, and we'll be able to get those donations to those who are in need. And so before I close, the CDC has issued new recommendations to cover your mouth and nose anytime that you are out. I will say to you again, the COVID-19 is in every zip code in Prince George's. For anyone who wants to know, it's in every zip code in Prince George's County. That means that we are urging you to continue to double down on your efforts to social distance. Please cover your face, wear gloves like me where possible. And I know we're approaching a holiday weekend, but we are asking you, please, not to convene in the way that we are accustomed to. I'm going to miss convening with my family as well this weekend, but we're going to ask you not to convene. And to remember to follow our healthcare professionals' advice. We know that if we do so, we can stop the spread of coronavirus. And I want to just say one last thing, because the winds are blowing and apparently the storms are coming, but to let every Prince Georgian know that we are working day and night for you. And we won't stop until the coronavirus is gone. And I've said it once and I will say it again today, the coronavirus will not have the final say. We are going to make it through this, even though we have some tough times ahead. I want everybody to be prepared for that. We're expecting a surge in at least the next 2 weeks. It's going to get tough. People are sick. People are dying. But we are going to make it through this together. And as your county executive, on a very, very personal note to Prince Georgians, I want you to know that I am not only working for you, and it has been a great honor to do so, but every morning and every night, I pray for you and pray for your families, and will continue to do so until we make it through this scourge. So thank you all so much for what you are doing. I want to thank all of these professionals who are the best of the best, who are standing with us today, for the work that they're doing, to all of our employees who are working and doing essential functions every day, and to our residents. We're going to make it through this together. Thank you. And now I turn it back over to Dr. Carter, our Chief Health Officer.
Thank you, Madam County Exec. Good afternoon. We're moving quickly on a number of fronts with multiple partners, as you will see. This is so that we can keep our health systems secure with additional beds, personal protective equipment, and other life-saving medical devices. At the moment, Prince George's County's hospitals have created an additional 175 beds above normal hospital capacity. That number includes acute care beds and ICU beds. We also have an additional 479 beds in progress with our partnership with the state, including the Laurel Regional Hospital. We are also working with our partners at the University of Maryland School of Public Health on the most recent data about cases in our county to better prepare ourselves moving forward. As the county exec mentioned, we requested the state to make us a priority in getting more personal protective equipment. That includes more N95 masks, gowns, gloves, and other critical equipment that keeps our frontline medical workers safe so that they can keep the rest of us safe. The number of new COVID cases per day goes up and up, by the hundreds now. Prince George's County is, and that's true even statewide. That doesn't mean that everybody who is positive gets hospitalized. As the county executive said, of the 1,464 positive cases we have, only 325 of them are hospitalized. But this shows how quickly this spreads in the community. Should I stop? No, I'm sorry. Okay, thank you. Okay. The rapid rise in daily cases will also keep going as the state and private labs clear testing blockades and return results to us. That's very important.
Yeah, so I'm sorry, Dr. Carter. So
Okay.
It looks like this storm is coming. So we'll go ahead and stop and reconvene. Go ahead.
Yeah, oh, yes, I can, because now, as you know, 90% of the labs that go out through commercial means. The commercial laboratories have been significantly backed up. I mean, at one point they were about 160,000 tests backed up. But right now they have sort of downloaded that backlog. So all of a sudden we're getting all the results, right? And it's sort of poured in this week. So they are saying to us now that it won't be backlogged. It should be. We should be able to turn those tests over in 24 to 48 hours. That's what they tell us. That's true. No, what they do is they pass their information along to the state, and the state passes that information along to us. And sometimes, that information doesn't quite get put in, it's human error. So there's a lot of times we don't get the racial makeup of who got positive and who isn't. It's concerning only to the point where we're looking at the trends. But as long as we have a pretty good sense, we feel pretty comfortable that we know what to do with that information.
What should the community take from this new information? It just confirms what everybody knows about how it's affecting people.
Yeah, it does. It just confirms what everybody knows. What we know about people of color is that they have a higher rate of diabetes. We have significant health concerns, and this virus doesn't care what color you are. If you have those high, if you're a person who's susceptible, the virus will come get you. So what we have to be sure is that our messaging into communities of color and everywhere else is consistent, and we help folks get to the point where they understand, like I said before, that they know how to social space, that they make sure they're washing their hands, clean their surfaces when they cough into their elbow, or have on a mask. The things that they have to do. That's what we have. It's all about messaging and make sure people doing what we want them to do. That's the bottom line.
There's another issue that's arisen with young black men and masks. There's some video that's come up elsewhere in the country.
That's not me. Well,
So for the Prince George's County community, for years, we have sought to enforce the law on behalf of the community, not to impose the law upon the community. I cannot speak to what's occurring on the national stage, but I did have a conversation with Mr. Ross of our NAACP just this morning. He's not receiving those complaints. We've made 3 arrests in 11 days for violation of that governor's executive order, 3 in 11 days, and these individuals would have been arrested otherwise. We are serving as a force multiplier for our health department. This is a public health crisis, and the women and men of this police department have stood up to work with their partners in health to ensure that we make this community safe, which is what we do every day. And we are not looking at how an individual is attired. We're looking at behavior when we engage. But the primary focus is to ensure that we all move through this safely, and that what started with COVID is another step in a years-long process to ensure professional, respectful, and constitutional policing in Prince George's County. So we're not seeing that, and I'm looking to my community partners. They're not seeing that. And as for what's going on around the nation, I'll leave those chiefs and those responsible people to address those questions.
Well, they're basically, they either come to us from the state or they come from various places, hospitals. Well, no, usually we get it because we know that those folks are positive, and then it's a recorded death. It doesn't hardly ever come. At least I'm trying to think of a case that hasn't come that way.
Okay, Dr. Carter. Yeah. Okay, real quick. So we're going to wrap up in less than 5 minutes. Do you have any questions either for Mary Lou McDonough of the jail or Dr. Wright, come on.
Yeah, just very quickly. Again, Dr. Joseph Wright, the President and Chief Medical Officer at the University of Maryland Capital Region Health. On behalf of the hospital community, I want to thank the county executive and her team for keeping us all connected. And I just left the hospital. Let me just paint a clinical picture really quickly of what we're dealing with here. We currently have 53 patients in the hospital who are COVID positive. That's University of Maryland Prince George's Hospital Center. 18 of those patients are in our ICU. 17 of those 18 are intubated. on a ventilator. And what has already been articulated by the county executive and health officer Carter is that the needs are in the critical care area. So sourcing ventilators, sourcing critical care equipment so that our staff can stay protected when all day long they are taking care of these patients is very important. And that's what the partnership with the county is resulting in. So any takeaway message as we lead into this surge has to be focused on our critical care needs. Most of these patients are on the ventilator for a prolonged period of time, and thus the need for ventilators over a much longer period of time is more than what we typically experience is what's happening in the hospital community. So with that, I will turn it over to... Yes, thank you for that question. So in collaboration with the state Department of Health and Prince George's County, we are on track to stand up 135 beds at the Laurel Medical Center. The target date is April 20th. 10 of those beds will be critical care, so adding a little bit to the critical care need. But again, my message today is that as we think about alternate sites of care, critical care is a very high need right now. Thank you for that question. Yeah. It is, and again, I want to be respectful of the weather. It is exactly what the county executive explained. We have a confluence of a community with comorbidities, underlying conditions, population density, particularly inside our Beltway communities, and those things are dramatically affecting what we're experiencing in terms of disease acuity in the patients that we're treating.
How's jail doing?
Well, the best thing that's going on in the jail is that the number of people that we have in jail has gone down considerably. A month ago, on March 8th, we had 733. Today, we're a new low, the lowest we've been in 30 years, at 597. And that's through the work with the courts, with the public defender's office, and with the state's attorney on getting people that don't need to be in jail out. We have had positive cases among our inmates and among our staff, and listening to Dr. Carter, I think those will increase, but none of them, they're all young, healthy people, so they've all been relatively mild cases. None of them have needed hospitalization, and they're being cared for in our medical unit. I don't know the answer to that. We report them to the health department, so. Yep.
Yeah.
You have more questions?
Is there any more questions?
We can do you off for who?
Madonna.
Okay.
Yeah, did we get everybody's questions? One more time.
I would just ask you, what do you make of these racial numbers? You know,
Yeah, so.
what are people in this community to take from this? It's kind of disheartening.
You know what? Well, what we take from the numbers is that now the rest of the world know what our reality is every day. If you live in a community that is poor, black, brown, or impoverished in America, there are certain health outcomes that you experience every day. And they come not for lack of caring, but in Prince George's County, if you can imagine, the wealthiest, predominantly African-American county in the country struggles to invite restaurants here that bring to us healthy foods, and it struggles to bring grocers here. So these are some of the realities that we live with every day, and they lead to the outcomes we're seeing. Diabetes, high blood pressure, kidney disease, lung disease, heart disease. And so what we have to do after the coronavirus leaves, it is my great hope that this is not just an interesting data fact or data point, but that we actually do something about what we have seen. This is uncovered for America, what is known in all of these communities throughout America. And we now have an opportunity once the coronavirus leaves, and we're rebuilding everything else. And as I've said, even about the business community, they've